Hi everyone, this is Dr. Lopez with another video. Today we're going to be talking about a condition called sciatica. Now, you probably have heard your friends or neighbors talk about somebody that have had sciatic type symptoms before. So it's very important to understand between what is the condition of sciatica and conditions that are sciatic-like. Let's talk a little bit about some stats here. 10% of U.S. population between 25 and 45 will experience sciatica, and it's most commonly found in people ages 40 to 50 years of age. So the typical condition will be, or symptoms will be someone that comes in with lower back pain shooting towards one or both legs. They may have numbness or tingling along with those symptoms. They may have burning sensation in their legs, and of course also weakness. So we want to address sciatica because of these underlying conditions. If you are 60 years of age or less, we want to find out if you have a herniated disc. Now, when we talk about sciatica, I should probably step back just a bit. What we want to take a look at is your lower back. So when you have a group of nerves from your lower back in this section here, they will group together to come down into your hip and will form one nerve called the sciatic nerve. It will travel down your leg, or excuse me, your hip, down towards your leg and your foot. That is basically what sciatica is an irritation of that nerve, of that group of nerves. So with underlying conditions, you want to address and see if you have an actual herniated disc. When you have a herniated disc, we've talked about this before in some other videos, you will have injuries to your disc or worn out discs that will start to complicate the lower back area, including the sciatic nerve. You also want to look at any underlying conditions such as degenerative disc disease. Again, we're talking about a disc, so basically degenerative disc disease is a wearing out of that disc. Another one that we should be looking at is also a condition called ischic spondylolisthesis. And basically that's just a fancy term for a break in a part of the lumbar vertebrae. It's called the pars, where if you have a fracture there, it'll start to irritate on that group of nerves. And so very important to find out if you have ischic spondylolisthesis, because we don't want to be adjusting in areas where there are fractures. Very important to know that. If you are 60 years of age or older, we typically want to look at underlying conditions such as lumbar spinal stenosis. And that's just basically a fancy term for the area here, the little hole where the nerve comes out. Basically, it's a narrowing of that space. So we want to take a look at that to make sure if that is the underlying condition. Another one to consider is degenerative spondylolisthesis. Again, we did talk about spondylolisthesis in the past. Basically, it is a bone that shifts forward. For example, this bone here, it shifts forward, and that is the term spondylolisthesis. But in this situation, you have a degeneration of this segment where the bone shifts forward, and therefore it starts to irritate that nerve. Some things to look out for when it comes to sciatica is people will complain about sciatic-like symptoms where they have back pain radiating down towards their legs. A lot of pregnant women experience this, where they have pain in the back and it travels down towards their legs. That's a typical symptom when it comes to pregnancy. Scar tissue. The reason why we have mentioned these as scar tissue, muscle strain, or bone fractures. More importantly, for the sake of this video, is we want to look at scar tissue and muscle strain. If you have chronic conditions where you have scar tissue built up, then it wouldn't be enough to just adjust the area. You want to address the scar tissue that's formed in these segments. So on that note, along with muscle strain, we want to look at some treatments. We have massage. Deep tissue massage will really help to address the scar tissue that's built up. You want to look at stretching, because there is another condition called Piriformis Syndrome, where you have a muscle right around this area of your hip that gets tight or is injured but more than likely it gets tight and it starts to irritate that nerve, that sciatic nerve that comes down on your hip, down your hip and your leg. So a good massage therapist will be able to find that and really dig in there and really relieve some of that muscle tension or strain that's happened. A good massage therapist. So that's where massage and stretching really come in to help out and fix this condition. Obviously, chiropractic, if we see that the hips are off or if the bone is out of place, a good treatment for that is a good adjustment to relieve the tension and stress that's built up in this area. Besides that, icing is very important. If you have an inflammation of anything when it comes to nerve, icing is usually pretty good. Usually they say between the first 72 hours. When it gets really bad, you can consider these other three. First, medication. My first year, one of the first patients I ever saw, he had severe sciatica. He had disc herniation, a history of disc herniation. So the way he came into our office is that he was in severe pain, bending forward and could barely walk. And there was no way we were going to be able to treat him and get rid of his sciatica. So he had to I sent him to the hospital to get the proper medications that he needed just to calm down the inflammation. So we did that. So that's another option, medication, at least to calm the area down to be able to treat later on. Steroid injections. I mean, there's patients that have had great results from it, and others that have felt temporary results, maybe 3-4 weeks, and then the pain comes right back. So it's important that you try different treatments before you start taking steroid injections. Obviously, talking to your doctor and find out if that would be a good option for you. Surgery is the other option that we can look at. Again, same thing. Have had patients that have had great results with surgery, and then others that have not. But as always, this would probably be like a last resort. Now I put down here exercise because most people tend to not do anything active during a severe case of sciatica, which is probably the right thing to do, just to relieve some of that stress that's built up. But overall, exercise is very important. It's very important that you start moving again. We want to build up muscle strength, muscle tonicity, and also if you exercise, any future flare-ups will be minimal. So exercise is very important. You also help relieve some of that stress by reducing weight. So exercise is also very, very important when it comes to managing sciatica. Okay, so that's basically our video about sciatica. Very common. A lot of people have experienced it. I'll actually, on this next segment, we'll look over one basic stretch that you can do at home. All right, so for this, for sciatica, this is a simple stretch you can do at home. This is what I try to tell my patients to do. And what you try to do is, if you have sciatica on your right side, you grab your right knee and you pull that right knee towards your left shoulder. You can either do pulling the left knee, or you can also incline forward so that you can feel a little more of a stretch. Later on, when you advance, you can actually put your hand on the knee and then actually twist and keep pulling on that knee, so you'll really feel that stretch in that right hip. Okay, so that's a simple stretch you can do at home. You hold for about 10 to 15 seconds, do it 3 times a day. And for more information, visit our website at Lopez Health Center, and we'll see you on our next video.